Sathi means South Asian Total Health Initiatives. What does it mean? How does one explain what is Sathi? Who started it? And why did they think about creating a group such as Sathi under the banner of Rutgers Medical School? To answer all these questions and to begin this special series, Sathi series, our first guest on TV Telugu channel Healthline is none other than the founder and the director of Sathi, Dr. Sunanda Gaur. Dr. Sunanda Gaur wears many hats. Director of Sathi is just one of them. Dr. Gaur is director of Clinical Research Center at Rutgers Medical School. She is also faculty for pediatrics. And she's also director for the AIDS program. And she is managing all these titles with great efficiency. And we will know how and why when we start talking with her. So let's welcome Dr. Sunanda Gaur. Welcome, Dr. Gaur.
Thank you, Varsha. First of all, I wanted to thank you very much for giving Sathi the platform and the opportunity to be part of this series. We are delighted that we are able to share something about Sathi, what it is, and what kind of work is going on here at Rutgers-RWJMS Medical School.
You're welcome, Dr. Gaur. You know that Sathi is really close to my heart because I am also part of Sathi. So the first thing that I want to bring to our community members is all the hard work and all the initiatives that are under Sathi banner. So without much ado, I actually want to get started with the origin and how Sathi took shape under your leadership. So if you can just take us through the history of Sathi and what was the underpinning, what were the initiative when you thought of creating this Sathi group?
Sure, I'll be happy to do that. Sathi is not very close to my heart. And really the starting of Sathi was a community effort, you know. It was not just me, there were a group of people that came together to form Sathi. So this is going back in 2007. So there was myself, there was Dr. Naveen Mehrotra, Assemblyman Chivukula, there was Dr. Poonam Aleg, Dr. Geeta Ghai, and Jigna Rao. So this motley group of people came together. And the reason was that we were seeing several things. First of all, you know, New Jersey has really a home for so many South Asians. And it is one of the fastest growing community in the country. The numbers right now, they're about 5.4 million South Asians that have made US their home. And New Jersey has the third largest community of the South Asians. And in particular, Middlesex County, where, you know, Rutgers is located, is one of the most concentrated collection of South Asians that have moved here and made it their home. So you knew that, but what is not evident, and most South Asians are doing quite well in terms of the jobs that they do, the employment, the businesses, they're quite successful as a community. So they are considered to be a model minority, okay, which means that here's a minority group that has come to a foreign country, has made it their home, and really been successful financially. So, you know, people look at them and say, oh, they're doing so well. But we know as physicians and healthcare providers, we as a group knew that there are many, many health issues that are facing this community, which is sort of hidden underground in the success, you know. And so we were seeing that, you know, most people don't realize that the prevalence of heart disease, cardiovascular disease, stroke, etc., is 3 to 4 times higher in South Asian community. And not only that, they get these diseases 10 years earlier at younger ages. Same is true for diabetes. Diabetes is twice as common in this community. And again, they develop it 10 to 15 years earlier than other populations. Along those lines, you know, one of the things is that we noticed that the community really doesn't realize this risk, you know, and they're not taking, we were seeing that people were not taking all of the preventive actions that need to be taken to mitigate those risks and reduce the disease burden in themselves and their families. So things like going to the doctor, doing prevention, you know, monitoring your blood pressure, you know, monitoring your diet, healthy lifestyles. Cancer screenings, for example, is another place where our South Asian community is among the lowest in all ethnicities in accessing care so that they could be screened for cancer. So, you know, we were noticing all of these different things. You know, mental health is another issue that's sort of driven under the rug, and people in our community don't talk about it. But we know it's a problem. We also know that if you look at all the people who access different types of mental health care, South Asians are the lowest. They don't go to the mental health providers. They don't admit to themselves and to their family that they have a mental health issue. You know, there's
That's
some
true.
shame associated with it. So these were all of the issues. I know I'm going long, but, you know, some of these things are really close to my heart, as you know, Varsha. So when we
Yes.
saw all this, we would be talking, what can we do? What can we do? You know, we know there are problems. So as a group, we came together and we said, you know what, let's start something. And so with everyone's effort, Sathi was formed, and it found its home at Rutgers, Robert Wood Johnson Medical School, because we had some visionary leaders that recognized that this is a problem, and we are well positioned to take a look at the problem, see what can be done, and move the agenda forward.
So, Dr. Gaur, I know that you are very good with names and coming up with these brilliant acronyms. So, how did we, the Sathi, came up with the name Sathi, which is so appropriate if we translate Sathi in Hindi, which means a friend or a companion. So, if you can talk about that.
Sure. So again, it was a group effort. You know, we were looking around to find something catchy. And the credit goes to Assemblyman Chivukula. He, you know, we were sitting around and then he said, oh, you know, let's add the total. Because we were saying South Asian Health Initiative in the beginning, and it was SAHI. And in fact, there was another SAHI at another institution. And he said, you know what, why don't we say total? Because we are going to be looking at the health with a more comprehensive way. You know, it's not just medical, we're looking at psychosocial, we're looking at alternative ways of treating things. So he came up with the total idea, and it was just so appropriate. And, you know, so that's how it came. It stuck.
I would really like this community to get a message about the goal, the vision and mission of Sathi.
So the overarching vision when we created Sathi was to improve the health of South Asians who have immigrated to the United States. So that's the overarching vision. The mission really is actually threefold, I would say. And we call it, it's three-part. First one is research. Second one is community outreach. And third one is education. So in these three, they're the three pillars of Sathi, which is what we've continued to do. And we do this through, so the research piece of this is very important because if you look at research in South Asians, there's very little information. It is the most under-researched community in the United States. So what a distinction we have. There are not many studies that are being directed towards South Asians. So the research piece is extremely important. And being at Rutgers, we have all of the wherewithal of Rutgers behind us to help with that. The research we are doing, and we have done all along, has been community-based research. So it's using the community's input in finding out what's going on with the community and using research methods to understand that. The second pillar is community education. So second pillar is education, actually, and it's divided into two. One is professional education, and the second is community education. So professional meaning educating physicians, other providers about the issues facing South Asian health, and also educating the new physicians and the new trainees so that when they go out and become the providers in the future, they are aware of the problems that is facing this community. And then there's community education, which means we develop programs to deliver culturally relevant, culturally adapted education to the community, okay? And then the third is outreach, where we really go out and work with the community, help the community, do health screenings, and participate in that fashion in a way to give back to the community as physicians. So that's been our thing, and we've continued to do that.
That Sathi is doing is really remarkable, and community needs to see what Sathi has done in past and what Sathi has planned for future. If you can share some of the initiatives and some of the programs that Sathi conducted in past.
It really needs to be reiterated and repeated because many people coming from South Asia don't identify as South Asians. And I'm an example. I'm from India. I never thought of myself as South Asian, until much later when the word became more commonly used. So South Asian classically is used as the people that are originating from India, Pakistan, Bangladesh, Sri Lanka, Bhutan, Nepal, and Maldives. So those are the 7. Some people include Afghanistan in the definition, but what we have stuck with is those 7. That's the definition given by SALT, which is an organization, South Asians leading together. So we've sort of stuck with that definition.
ఈ పండుగ సమయంలో అందరూ గెలుస్తారు మలబార్ గోల్డ్ అండ్ డైమండ్స్ లో. గోల్డ్ లేదా డైమండ్ ఆభరణాల కొనుగోలుపై గోల్డ్ కాయిన్స్ ఖచ్చితంగా గెలుపొందండి. పైగా 10% అడ్వాన్స్ చెల్లించి గోల్డ్ రేట్ల పెరుగుదల నుంచి రక్షణ పొందండి. బంగారం ఎక్స్చేంజ్ మీద 0 డిడక్షన్ ఆనందంగా అందుకోండి. 10 దేశాల్లో 250 స్టోర్లలో బెస్ట్ డిజైన్లని బెస్ట్ ధరల్లో పొంది గ్యారంటీడ్ గోల్డ్ విన్నర్ అవ్వండి కేవలం మలబార్ గోల్డ్ అండ్ డైమండ్స్ లో మాత్రమే. మలబార్ గోల్డ్ అండ్ డైమండ్స్, celebrate the beauty of life.
Everyone in this country, they really need to understand how we are envisioned by the global scientific community, correct? And again, going back to my other question that was embedded in this one is, if you could talk about some of the past initiatives that were well received, that generated a lot of community partnerships, which can give an idea about what Sathi has done so far.
Sure. So let me talk about it by dividing it up into the types of initiatives. So I think the first I would say is conferences. Okay, one of the first things we did, actually we did things simultaneously, but one of the first things that was the most prominent things we did was a first of its kind conference on South Asian health and health literacy that took place in 2010. It was a large conference that attracted a large swath of the community. Over 100 people, 150 people attended. And we came up after that, it was a full day conference with multiple participants, researchers, community members, all types of people involved in South Asian health issues, public health, nurses, social work, everything. It was very comprehensive to bring together all the people. And then we came up with a set of recommendations at the end of that conference of what needed to be done, what the needs were perceived by people who were living it and working with this community, and what actions needed to be taken. So that was one of the first conferences. Following that, we have, at this point, we've put together 9 different conferences addressing different issues such as maternal child health in South Asian, mental health in South Asians, stroke, in which Varsha, you were a speaker, if you recall, and so on. So we have, and we continue to do that. In fact, our next conference, which was supposed to be in October, which is now postponed because of COVID, will be held next year. And it will be dealing with the Cello Project, which I will talk about later, and the findings of the Cello Project. So that's one big piece of things we've done in the past and we continue to do. And that is the conferences addressing the physician community as well as the community in general, and other practitioner communities. The second piece is community-based research. And as you mentioned before, Varsha, is that how we first got involved. And I very clearly remember sitting in my car having a phone conference with the American Association of Indian Nurses, which you were part of. We got you all involved, and we were starting our first community survey that we undertook to ask the community what their health needs were. So that needs survey took place in 2009 to 2008, 2009, in that time frame, and it was eventually published. And so we got a lot of information from there of what to do next. So from there on, we've done, so that was a general health survey. And we found that people were not doing preventive health measures. We knew that, but we got more information about that. Then we've done other surveys since that. Then again, to do with, we've done a survey with infectious diseases, particularly HIV, tuberculosis-related survey. We are planning a COVID survey, which hopefully will be off the ground soon, to measure or to find out how South Asians have fared during COVID and what their challenges were as they were dealing with COVID. So those survey studies is another piece of what we do. The last is community outreach and education. And one of the biggest projects in that we undertook, Varsha, you were a leader in that one, was the SAHAS project, was the South Asian Health Awareness about Stroke. And we really, with your leadership and your knowledge about stroke and stroke education, we created a curriculum really directing culturally adapted for South Asian community. And we administered that. That was a 5-year project that we were funded from the state of New Jersey, state of minority, the Department of Minority and Multicultural Health in the in the State Department here in New Jersey. And we went out, we created a new curriculum, and we went out and we educated groups of people, anywhere from 15 to 20 groups of people would come in. They would get educated about stroke, how to recognize stroke, what to do if you saw someone having stroke, and how to prevent stroke. And this was done, initially it used to be 3 sessions, then it was 2 sessions. And people really appreciated and learned. And so in this way, through that Sahas project over a course of 5 years, we probably educated, somewhere between 500 to 600 people who became, and then we also educated people to become stroke talkers so that they could take the message of how to recognize and prevent stroke to the community, so they could tell others how to do it, so that this way it's a snowball effect. Whatever you taught to one group, doesn't just stop there. They can take the message forward to other people. So we've done projects like that. We've done a project similar to that in travel health, whereby we educated people about what the risks are when you travel back to home country with malaria and hepatitis and things like that. And we created health talkers. So again, the same way to educate the community about the health risks related to travel. So, so I think, those have been sort of the projects we've done through Sathi, and we continue to do.
Mm-hmm. As I'm listening to you, I'm just kind of awestruck that there is so much work. It's already been put in over the years, and not just community partnership, but Sathi has now partnership with very well-known and reputed organizations such as CDC, what you talked about, Health Talker,
right?
Was in partnership with CDC.
Correct.
And also what I remember from 2009, the most impressive project that we, Sathi, completed was chronic disease self-management with Stanford, with the Stanford University. And that was also grant funded by Department of Health. So if I know that you will, if you sit down and if you talk about project, you will take probably one whole day.
Right. Right.
And I remember talking to you when we were preparing for Sahas needs, when we were writing the grant. And I had said, I'm just reading the report, and Sathi has about 44 plus community partnership. And that knowledge itself was making me really proud. Like Sathi founded a seed, and now it is a tree and lots of fruits.
Right.
And it's growing. So you provided a lot of information of a lot of different projects that were undertaken. And you also talked about how Sathi has 3-pronged approach, 3 pillars, where not just community, but you are also disseminating the same knowledge to providers. So be our partners, be our Sathi, like you always say.
Right. Be our Sathi. So you're right. I mean, one of the most rewarding thing has been the partnerships with the community. Like you said, the tree is growing and forming new trees and new partners. It's really been very rewarding to have that community partnership. So in terms of what we are excited about currently, a couple of things come to mind. One is we have a current project that we are doing with the Sai Mandir in Piscataway, Edison area. So that is we are working with the temple. So we have some funding from CTSA, which is the Clinical Translational Science Award group here at Rutgers, to work with the temple leadership. And we have about 5 or 6 actively participating community leaders from the temple who are advising us on how to modify the diabetes. The CDC has a diabetes prevention curriculum for community education. So in working with those community leaders from the temple, they are helping us tailor that or translate or fix that curriculum so that it really relates to South Asians. For example, the foods that are mentioned in that curriculum. We completely changed that to look like what South Asians eat. Similar to that, cultural things that South Asians do. So include that in the curriculum. So the whole idea of this curriculum is to prevent diabetes. So it's for people who are pre-diabetic. So they're at risk for, and a lot of our community members are pre-diabetic. It's extremely prevalent. So the idea of this is to teach ways to eat healthy and live healthy lifestyle so as to prevent development of diabetes. And it's as we say, evidence-based curriculum so that we know it works. So we are in the process of creating that curriculum, and we hope to have it done by the end of this year. We are having very active Zoom meetings with the temple people, and we are very thankful to them. So once it's done, the plan is that we'll apply to get this approved by CDC, and then this will be available to administer to different community groups, South Asian community groups. So that's one project. The other one that's an ongoing one is the Chalo project, which is maternal child health. It's about healthy nutrition in early childhood feeding, which you'll hear more about from Dr. Ramachandran next time. So I just wanted to say that that's a 5-year project that we are in our 4th year now. And the findings of that will be presented at our conference. One of the things we've done in that project that we've just finally analyzed the results is we've surveyed pediatricians who are taking care of South Asian families. And we have some really, really interesting information that we are getting from pediatricians on what they are seeing in their patients and how the issue of overfeeding and babying and continuing pureed feedings for a very long time. I mean, those are the things we know are prevalent in our community. So we're getting more evidence of that, and then we'll take that forward from there.
Yeah, that would be a very interesting cultural study and really a great report to share with the community and understand from a pediatrician's perspective what is a healthy nutrition and how to feed a child.
Varsha, I want to mention one more thing because this is
Sure.
really exciting. So one of our partners is the Institute for Health and Aging at Rutgers. And they have recently gotten a large grant from Robert Wood Johnson Foundation to develop a 10,000 people cohort of immigrants in New Jersey.
Very nice.
And in that cohort, they are particularly focusing on Indian Americans that have immigrated because we are such a big part of this community. So there will be, so we're in the planning phases and Sathi is part of this. We will be wanting to enroll over, something like 1,000 or 1,500 people into a longitudinal cohort, which means they will be followed for a long period of time, and then to enroll families. So it will be, let's say, an Indian family member, person and their children and grandparents, the whole unit, because we are always so often together in joint families. So, and then those family units then will be followed, and they will be looking at health markers, and coping skills and psychological there'll be a lot of study of those families to see how they move, how they do over time. Be first of its kind. There is no cohort yet in the
almost country. Yeah, it almost sounds like a real-time anthropological study.
Yes,
not really anthropology,
right. But it's health.
Time.
It's related to health, so we could be looking at health outcomes.
Very interesting.
So we'll really be reaching out to the community for this project, and I'm really looking forward. In fact, Varsha, you don't know this yet, but you're one of the people I'm going to really get.
Very nice. Thank you for sharing here on the show.
ఈ పండుగ సమయంలో అందరూ గెలుస్తారు మలబార్ గోల్డ్ అండ్ డైమండ్స్ లో. గోల్డ్ లేదా డైమండ్ ఆభరణాల కొనుగోలుపై గోల్డ్ కాయిన్స్ ఖచ్చితంగా గెలుపొందండి. పైగా 10% అడ్వాన్స్ చెల్లించి గోల్డ్ రేట్ల పెరుగుదల నుంచి రక్షణ పొందండి. బంగారం ఎక్స్చేంజ్ మీద 0 రిడక్షన్ ఆనందంగా అందుకోండి. 10 దేశాల్లో 250 స్టోర్లలో బెస్ట్ డిజైన్లని బెస్ట్ ధరాల్లో పొంది గ్యారంటీడ్ గోల్డ్ విన్నర్ అవ్వండి కేవలం మలబార్ గోల్డ్ అండ్ డైమండ్స్ లో మాత్రమే. మలబార్ గోల్డ్ అండ్ డైమండ్స్, celebrate the beauty of life.
Like I want community to watch this Sathi series completely. So I would say, if you want to know more about this enrollment, continue to watch our Sathi series.
Correct. Absolutely. There's a lot. So the other real pleasure with Sathi has been that so Rutgers is a unique place because we have a large number of South Asians, physicians, medical students, nurses, on all walks of medical life. And people, they have come to Sathi. They know about Sathi, and I hear from them all the time. What can we do? They are so interested in doing something for the community, They're just dying to do things, and they want to give back. And that's been so rewarding for me to see. So for this series, I just sent emails out that Varsha's doing this, and almost everybody said, yes, of course, they'll do it,
Yeah,
we have a lineup of 12 sessions for you. And the thing is, each of these people are real experts in the field that they're going to be talking to you about.
Yes, and that is going to serve the purpose of doing this Sathi series, because not only we are getting the word out, not only we are talking about at a larger scale about Sathi's work and Sathi's achievements. Now we are opening up a big portal for the community members to explore the number of projects or number of our initiatives that were done in past, and take advantage of the literature or the resource material which is already out there. But then we are also inviting them to be a part of the future initiatives. So I think this is a win-win situation. And hope that more and more people will be engaged in Sathi through this Sathi series. So, Dr. Gaur, going forward with the conversation, we talked about the past project, we talked about the future initiatives. I just want to talk about when Sathi is doing all these projects and making community partnership, how can they get information on continuing basis? Are there any portals? Are there any mediums? If they have any question, or if they have any need to reach out to someone, what is the best way that they can communicate with Sathi?
We do have a Facebook page and a website. The best way to reach out to us really would be to reach out to our coordinator. And I could, Varsha, give you the email of Bishaka Ghoshal. She is sort of the fulcrum. So it's important. She would be the best person. Certainly, anyone can reach out to me. I'm very open to hearing from the community. And I do, in fact, hear all the time from people interested. So those would be the ways.
Okay, so at the end of when we complete the series, I definitely in between we will request, there is a Facebook page where we keep on posting our current activities, and we will share the website, and we will have a structured way how to approach and what exactly is your question, because we really do not want to overburden the inflow to one person who is a coordinator. And I believe TV Asia Telugu channel, they will have a medium through which we will partner, and we will create a kind of a communication portal. That way it's easier for people to reach out, ask questions at the same time. Not really, you know how sometimes you can get 10,000 emails and you don't know what to do with them.
Right.
Yeah.
So one of the things I would say is, we've always said this about Sathi. When we reach out to the community, we are educating the community. Okay, we are not really acting as your physician, even though many of us are physicians and practitioners. So to give, I always say, we can give you general advice, but to give a particular advice of your particular situation, we usually refer you back to your doctor. That's probably the best.
Yes, that has been our always a guiding tool. Because we have our projects are geared towards a larger community research, community education, and provider education, but not an individualized care. So now, Dr. Gaur, I'm going to take you to a different tangent as the director of a clinical research center. And at present, everyone is focused on one thing, that when are we going to get the freedom from COVID? That's one big question, and it's almost like a question looming in the air everywhere we go, because it has changed our lives. We are living completely different life, which we had never thought about. But still, it's important that we all stay healthy and safe. And as the director of Clinical Research Center and highly involved in research, I would like to hear from you. If you can share some of your suggestions, recommendations, and what's happening.
Yes, thank you for that. I have been living COVID these days since it all started, as many of us have, both at clinical level, but even research-wise. So let me say a few things. First of all, I think Rutgers, as a medical, the Robert Wood Johnson Medical School, the New Jersey Medical School, and the Rutgers University, has really been at the forefront of fighting this epidemic on the research front. Certainly on the clinical front, our doctors and nurses have been just amazing in what they've been able to do. But on the research front, Rutgers has really taken the lead in many different areas. To start with diagnostics, the saliva test, was developed at Rutgers and is, now available. Now there are more saliva tests, but the first one was at Rutgers.
Congratulations.
Yes. I mean, it actually, some of the studies we participated in, we did a large healthcare worker study to see what their risks are of getting COVID. And we actually gave some of the initial saliva samples that ended up becoming a test. So I don't take credit for that. It was developed at a laboratory at Rutgers, but ours was the first saliva test. We participated in a number of clinical trials with the antiviral remdesivir, which is now standard of care for COVID treatment, and some other medications. We did this large healthcare worker study that has really informed us about what the risk of healthcare workers are. For example, one of the things we found is that phlebotomists, the people who draw blood, are really at one of the highest risk. And nobody thinks of them because, they're not nurse or doctor. But think about it, they're always going into the patient's room a lot, and they see a lot of patients in one day. So we found in our study that they are one of the highest risks. So now for phlebotomy, we are providing them more PPE so that they're well protected, you know. So the things like that are useful to get information on. And the biggest news, and we heard this today actually, it's a lucky day, Varsha. We heard today that we are a site for the Johnson & Johnson vaccine trial, which will start here at the center that I'm at. So I run the Clinical Research Center at the Robert Wood Johnson Medical School. There's another one in New Jersey Medical School. So the vaccine study, the Johnson & Johnson vaccine study, will happen at our center here. And we hope to be opening up in about a month and less than a month and a half. And we will be needing community participation, and I would really need the word to go out to the community to participate, because it's so important to be part of clinical trials. Because, you know, if new things are developed, this is true for drugs too, medications, that if they're not tested in our genetic community, then we don't know if it's safe or not safe, what is the right dose. So we do need to participate as a community in some of these trials. So we're very fortunate that we have that. And Varsha, I can give you information on who to reach out to for the trial, the Johnson & Johnson trial, as well as the Moderna vaccine trial, which is now open at New Jersey Medical School. I can give you who to reach out to, that you can share with the audience. And we're looking for some participation from our community. It would be really good. It's a good opportunity to get in at the ground level for something groundbreaking like the vaccine. So that's the other big news in terms of what's going on with COVID. Everybody's waiting for a vaccine, and the sooner we can get the studies done, the sooner we will have it available for people.
Thank you, Dr. Gaur. That was beautiful message, simply said. I'm really looking forward to having community members partnership and watching this show, the Sathi series on Healthline TVASIATELUGU channel. After this episode, we are also bringing many Sathi members and Sathi physicians who will be coming on this show and sharing their expertise, as well as they will also share how they are using their expertise in different Sathi projects. So this was a great beginning of Sathi series, and thank you for your time and your expertise, and hopefully we will see you in another episode of Sathi series as well. Until next time, see you all again on Sathi series Healthline. Saying bye for now, your host Varsha Singh.